Hello and welcome back. I'm Dr. David Curry and we're going to continue with part 3 on this video series we're doing on the topic of sciatica and sciatic neuralgia. Today I'm going to describe just a little bit more in detail of how do we actually evaluate and find out where the source of the problem is with these type of conditions. So let me just say this, that first off, number one, the most important thing that I have to deal with when we have a patient who presents with sciatic neuralgia is to determine where is the source and the cause of the problem. Where is it coming from? So my job really comes down to the 4 steps. Number 1, I interview the patient. Number 2, I do an examination. Number 3, I make a diagnosis based on the interview and the examination. And then number 4, and lastly, we actually dictate treatment and start the treatment program. So rest assured that when you come into our office, we're not going to just jump on your back and start cracking your bones and moving things around that don't need to be moved around. We're going to do a very thorough evaluation and examination. That physical examination is going to include a range of motion, not just of the passive range of motion that you have, but I'm going to take a close look at the way the joints of the spine are flexing and bending, and most importantly, I'm going to look for where the restrictions in the joint movement are. Let me give you an example. For instance, if a person bends freely to the right side, does not bend freely to the left side, that gives me a very clear indication that what we need to do is make sure that they bend better to the left side. So that is going to be determined from the examination. We're going to also do some other general orthopedic evaluation and testing to find out exactly where the problem is coming from. We'll do tests that are going to help us differentiate whether it's a lumbar spine problem or if it's a sacroiliac joint problem, as we discussed yesterday. There are a lot of different opinions as to how to treat these kind of problems. I'll go more in detail tomorrow on our report on how to actually treat these problems, but rest assured, when you come into our office, we're going to take the time, do a very thorough evaluation and examination, and find out where the source of the problem is, and most importantly, we're going to determine if it's a problem that can be helped with chiropractic care, and if it's not a chiropractic care related problem, I'll make sure to make the appropriate referral. So again, I'm Dr. David Curry. Thank you for joining us today on part 3 on our series on sciatica. And you have a great day and be well.